Chapter 4, Lecture 2. Now let us look at the body systems of the newborn. All of the body systems, the blood circulation, respiration, nourishment, waste elimination, temperature regulation, all have to move from relying on the mother's body to independent function. The baby's body has to start doing all of these things by itself independently. Breathing and blood circulation are very important. During the birth process, anoxia or hypoxia, that means no oxygen or low oxygen, these can lead to birth trauma, that is, the brain can be damaged because of oxygen deprivation, and this damage can be lifelong. What are some possible consequences of oxygen deprivation? I don't know what you have heard of in your previous experience, but these consequences can include cerebral palsy, mental retardation, learning and behavior difficulties, with other body systems and functioning, such as difficulties in hearing or sight and so on, depending on which areas of the brain are affected and how serious the damage has been. Another possible condition that infants might experience is neonatal jaundice. 3 or 4 days after birth, about half of all babies develop this neonatal jaundice. That means the liver is still immature and their skin and eyes start turning very yellow. This is not serious and does not need treatment and does not have any long-term effects. However, it must be monitored to make sure that it is a mild situation and it is resolving on its own, because if it's one of the rare cases of serious jaundice and it's not monitored, then this can result in brain damage and lifelong challenges for the baby. As soon as the baby is born, right there in the delivery room, the doctors conduct a basic assessment. The most basic assessment is called the APGAR assessment, and the baby is given an APGAR score. The APGAR scale is named after the inventor Dr. Virginia Apgar, and you will see that the APGAR scale is named after the last name of the inventor, Dr. Virginia Apgar. So notice the spelling of her last name, A-P-G-A-R. Conveniently, that stands for the 5 aspects measured in the APGAR score. A is appearance. The baby should be pink and healthy. If the baby is blue and pale, that's not good. P stands for pulse. Pulse measures the heartbeat. The pulse should be rapid and strong. G stands for grimace. Grimace means appearance, and it shows the reflex irritable expression on the child's face. So if the child is coughing and crying, that is a good sign. That means the lungs are working well and the child is breathing, and this is good. In fact, in the older days, you might even see these scenes in old movies. As soon as a baby was born, the doctor or midwife would hold the baby up by the heels. They would hold it upside down and give it a sharp spank on the bottom to make it start crying if it was not crying already. The next A stands for activity. The child should be strong and moving its legs and arms vigorously and crying. R stands for respiration or breathing. Again, if the child is crying loudly, that means it's breathing strongly and well. So once again, the APGAR scale is APGAR, named after the inventor Dr. Virginia Apgar, and a high score on the APGAR scale, that is a score of 7 to 10, achieved by more than 98% of babies in the US, indicates that the baby is in good to excellent condition. A medium score, that is around 5 to 7, means the baby needs help. And a score below 4 means the baby needs immediate life-saving treatment. Another scale that is used in the age range up to age 2 months is the Brazelton NBAS scale, the Brazelton Neonatal Behavioral Assessment Scale. This test shows the baby's responses to the physical and social environment, and it tests several domains, including the motor organization, that means how well the movement and muscles work, their reflexes, their state changes, that means are they going from calm to crying and back to calm appropriately, do they have appropriate attention and interaction capacity, and the central nervous system stability or instability. The NBAS takes about 30 minutes to administer, and the scores are based on the baby's best performance. Newborns can also be routinely screened for various medical conditions. Now, routine screening is expensive and sometimes yields false positives. So why should you want to do it? Because failing to identify some rare conditions can lead to lifelong challenges such as mental retardation that are even more expensive to live with. So these correctable disorders can be caught right there in the newborn period through this type of neonatal screening. PKU stands for phenylketonuria. There's another condition called congenital hypothyroidism. There's galactosemia. There are all sorts of rare conditions, and if there is some reason or some genetic reason to suspect that the child may have this, or otherwise just screen routinely all babies, you pay that expensive test, but you can correct rare disorders in children, which is a lifetime implication. Infant arousal basically refers to the periodic cycles of sleep, wakefulness, and activity. So arousal is the degree of alertness in these different types of activities. This is highly inborn and highly individual in a child, and it basically indicates the appropriate stage of brain and body functioning. So the different arousal states include the sleep, irregular and regular, drowsiness, inactivity, wakeful, and crying. And we don't need to go into very much more detail on this, because all that it means is that this is the amount of time that a baby sleeps and then the amount of time that they are awake. By 6 months, typically infants are sleeping for 6 hours through the night, and they wake maybe once or twice to feed. In different cultures, the sleep patterns may vary. Let us now turn to childbirth complications. And the most important childbirth complications include birth trauma. That's some of the things we just talked about, like the anoxia or hypoxia. There's post-maturity, that is a child taking too long to come out. But the most important childbirth complications include prematurity or preterm birth, when the child is born before 37 weeks of gestation, and low birth weight. So let's look at some of these issues. Low birth weight means the child is born weighing less than about 5.5 pounds. Very low birth weight is less than 3.5 pounds. And obviously, the lower the birth weight, the worse the situation of the baby. Across the world, about 15.5% of births, most of them in developing countries, are of low birth weight. And this could be for various reasons, including poor nutrition of the mother, lack of prenatal care, some infection or illness, or some genetic disorders or defects, a variety of conditions. Another issue is called SGA, that is small for gestational age or small for date. This is different from low birth weight. Low birth weight is usually found when the child is born prematurely. But small for gestational age means the child for the age at which they are in the womb, whether it's born full term or born premature, they are smaller than the average for that much time. And this is due to inadequate maternal nutrition or illness or genetic defects. And being an SGA baby, it shows slow fetal growth and development, and the effects can be lifelong. We pay a lot of attention to prematurity and low birth weight because this is the second leading cause of infant death in the United States after birth defects. So prematurity and low birth weight are something we are going to discuss again further. Prematurity and low birth weight are more common among women of minorities and lower socioeconomic status due to a variety of reasons. So let's take a look at those reasons. Who is more likely to have a low birth weight baby? So here are some of the maternal characteristics. Mothers who are underage or overage, that means mothers who are younger, young teens, or overage, over the age of the late 30s. Women who are less educated or poor, this means they lack prenatal care, they lack health care access, they lack nutrition, they lack a healthy lifestyle. They may have a lot of social and economic pressures on them. Some mothers have pre-existing medical factors, that they have a history of preterm or low birth weight babies. They themselves may have been a low birth weight baby. They are too thin or too short. That means this reflects some systemic problem with them, either a lack of nutrition or some other health problems. They may have genetic conditions. They may also have hypertension. Behavioral and environmental factors of the mothers include poor nutrition, smoking, alcohol use, or other harmful substances, stress, and remember, conditions like prolonged poverty or racism and so on include that create stress. And medical conditions during the pregnancy, including infections, hypertension, anemia, depression, lack of weight gain, cesarean deliveries indicating a distress for the baby, delayed childbearing, and an important one is the use of fertility drugs, which leads to having multiple babies, and multiple babies like twins, triplets, and so on tend to be smaller. A higher percent of low birth weight babies in the African American population is a major factor in the higher mortality rate of black babies. Black babies have a higher mortality rate compared to the general population, and prematurity and low birth weight plays a role here. And the reasons include the lower socioeconomic status and lack of nutrition and health care, stress and racism, and include some genetic variation also in this group.